Well, Dr. Boyers, thank you for joining me today. I greatly appreciate you making time. I know it's taken us a bit of a couple months to get this scheduled. How are you doing today?
Doing well, thank you, Bob. And you?
Not too bad. The weather is a little nicer today in Washington. The humidity is down, so that makes it quite a bit more bearable.
Yeah, in
Um,
Ohio too. I'm sitting here on my farm, working remotely today.
Fantastic. Actually, it was funny. I had a call with somebody yesterday. And it was a video call, and they were in somewhere in Alberta, working remotely, but they were running off of a Starlink.
Oh,
I don't know if and it was doing video up and down very very well. It was quite impressive.
it's very cool. It's good to hear communication strategies and systems are expanding so that more people have access, right?
From anywhere, anytime.
Yeah.
So I don't know how your connection is on your farm, but you can always switch to Starlink if you need to. Not and I'm not. We're not being supported by Starlink in any way. So that wasn't wasn't a promotion.
I understand. Thank you.
So look, much of the reason I wanted to have you on was when we first met. Getting close to 2 years ago in Tampa for the first time in early 23. We were sitting next to each other for dinner, and you shared your background story on kind of how you came to the U.S. and you're working your way through school, and it wasn't easy. But it was a fascinating story, and if you're open to indulging me, I'd love to have you share it again with a larger audience, and with as much details as you're comfortable in providing.
Well, thank you. I'll be glad to. I'm not actually used to talking about myself very much. I'm better talking about projects and aspirations and strategic vision, but I'll be glad to share what I can with you.
Well, I appreciate that, and a lot of people don't like talking about themselves. I'm one of those as well. But I think everyone has a story to share, and I think the more you understand about someone's background, why they're where they are today, it helps inform a little bit and to better guide and figure out how to work with that person moving forward.
Well, thank you. Well, I'll do my best. Yes, it's been a long journey. As you know, I'm still working, and a lot of people would think I'm pretty crazy. But strangely enough, even my 80th decade they've been some of the most productive years professionally of my life. So I feel very fortunate to have had a long journey. But my journey started in Portsmouth, England. I was born on the night of February the 28th, 1941. And I think everybody knows what was happening in the world at that time. Portsmouth Harbour was being bombed pretty significantly that night. It was the night of the Blitz. And I therefore came into this world a little early. um, and that was the start of my life.
When you say you came in a little early, what do you mean by that?
Well, the bombing and the stress upset my mother, and she went into labor a month early.
A month early. Okay. Wow.
The story is, the family story is that I was born under the kitchen table because everyone was trying to shelter from the bombing and the soot that was coming down the chimneys and so on at the time. So it was a rather, as I understand it, abrupt entry into a very difficult world at that time.
I mean, that is something to picture and try to mentally see. I mean, being born during a night of the Blitz,
Right,
during the period.
right. And on the other hand, as difficult a time as that was in the United Kingdom, in England, it was a time when everybody was pulling together. So I was raised, even though I was raised in difficult and austere times because of the war, I was raised in a community where everybody was pulling together and being mutually supportive. And in fact, it was somewhat of a matriarchy looking back. I didn't realize it at the time. But all the men, especially the active men who fit and active, were away at war. And a lot of us didn't see our fathers, me included, until I was 6 years old. And
Your
during that
your
time,
your father was in the war at that when you were born.
absolutely, went to war at 21 years old, like so many of the other young men. And the women were left to sort of manage the home front, as they said.
And
And
and you said you didn't meet him for 6 years, so a couple of years after the war ended.
yes, well, it was a little while after, a year after the war ended. Yes,
Okay,
um,
was he? I guess he was still stationed overseas for a period.
that's right. They took a little while to come back.
Okay,
So, it was looking back, I didn't realize it at the time because as children, you always think what you experience is normality. It was a rather extraordinary time to be raised, but it had the advantage of being raised by very strong women and very resourceful women, and also managing without a great deal of belongings or assets. And so it kind of gave me a sturdiness, which I think has helped tremendously in my journey throughout life.
and did you have siblings?
I had a sibling, yes, 6 years, 7 years after the war, yes. He was, well, actually, that's not true. He was 6 years younger than me, 6.5 years younger. So, yes, when my father came back from war, another baby was
So,
added.
so, so you were the first, and so your father was sent to war at 21. How long had your parents been married?
Well, what happened in England at that time, people who were engaged and who knew how serious the war was going to be, and that was the majority of the public, they decided rather than to have long engagements to get married. So a lot of people got married just before the men were deployed overseas. So it was probably a very short engagement of about a few months. And then as it became more clear what was happening, you know, in wartime, and that there was going to be, a parting for some time. A lot of couples decided that they would get married before the men were deployed.
So, what was your life like during the 50s then? So, at that point, you'd be in high school and going on to early college.
Well, my life, you know, it. I don't quite know how to answer that, but um, we were raised during a time when the men were coming back from war. And instead of living in communes, everyone was getting more adjusted to living in a house with a mother, father, and if they were lucky and their fathers returned, and their siblings. And again, these were times when the men were readjusting to come back, and they had been gone as very young men for several years. And I think the adjustment for them was very, very difficult. And nobody recognized that at the time. There was no understanding at the time of post-traumatic stress or the impact of war on young people. And so they were busy trying to reconstruct their lives. My father had been a medic in the military, and he came back wanting to better himself. So while we were going to high school, he was adding credentials to become a physical therapist, and then ultimately he was involved in osteopathic medicine, which was just emerging at the time in England. So I don't think as children we knew any different. What I can tell you is that when we played out of doors a lot, we did in those days. We played on the bomb sites. They were our playgrounds because so many houses had been bombed and destroyed, and the gardens were still there. So we would play hide and seek, and we were pretty carefree because we don't think we fully understood as children the full impact of what had happened.
And was your father being a medic and staying in medicine? Did that influence your career path greatly?
I didn't realize it at the time, but in hindsight, I believe it did, because he was an innovator in his time. And one of the things he understood, which I think has had a great impact on me, is the mind and body connection and how critical it is not to split the two when you're looking at humans with illness or otherwise. And I think that greatly affected me, although, again, it's sometimes we realize these things too late to think them, right?
Did your mother and father live long lives, or when did they pass?
Well, my father passed young. I mean, he came back from war again, like so many people did, with problems with alcoholism and stress management, and it took a toll on a lot of their lives. He died in his mid-60s, which was far too young. But again, I believe it was the effects of wartime and what he'd experienced as a young man. He was a very talented man, but a lot of these men came back with demons, and it was hard for him to fight those demons. So we actually ended up, I was raised for the rest of my years with my grandmother. And again, she was the sort of matriarch of the household. She was a very strong, very creative woman. And I inherited a lot of her. She had a great influence on me, let's put it that way. She was intrepid.
That was your father's mother, or your mother's mother?
My mother's mother.
Okay.
Yes. So I suppose the lesson is that you sometimes don't know quite who your role models are when you're a child until you look back and you see the journey you've been on and how different people influenced you throughout your life. On that point, I think it's awfully important to thank people when you can.
Absolutely.
No.
Absolutely. So there was a story you shared with me on and I don't remember the timing of when your first marriage and when you got married and coming to the U.S. and starting school. So I don't remember the timeline of that very well. If you're comfortable in going into that.
Yes, again, being raised in post-war Britain in the 50s, there weren't a lot of options open to women professionally. Again, I didn't begrudge that; it was just life. But generally speaking, you had the option to become a teacher or to go into nursing, or a lot of people got married right after high school. If you were very fortunate and you had, good families with influence and money, some women were going to university, but that, for obvious reasons, wasn't going to be my choice. I wasn't raised in a family with a great deal of money or influence. So after talking with a favorite aunt about it, I decided that I would go into nursing, and I got a position in a London hospital, in a training hospital, and absolutely loved it. I loved everything about it. I began to find out who I was and what my capabilities were, and learned a tremendous amount from patients.
So can you explain a little bit about what the process was of becoming it? So it wasn't going to nursing school formally. It was kind of like an apprenticeship.
No, it was a nursing school. They did have nursing schools, and they were very different, though. You did clinical work alongside your education, but it was a very, very good education with very good and dedicated nurses who were the faculty members, or as we would call them now, in this London hospital. And we did a mix of classes and then patient care classes and patient care. So the patient care was intertwined with your learning right throughout your training. But I do feel I had an extremely good training, learned a tremendous amount about life and about people, especially working in emergency rooms and working at night and working in the ORs. I just felt like a sponge soaking it all up. And again, when I look back, a lot of my lessons were from the patients I took care of, as well as my colleagues.
So how long did you work at that hospital, and how long was nursing school?
That was 3 years at the time, and I stayed on and did an extra year, and then I became what they call in England a ward sister, and managed a ward of orthopedic. They had two wings, an orthopedic wing and a gynecological wing. And actually, I was on duty I was getting on night duty the night that Robert F. Kennedy was shot. And the whole of England was also in shock, as was America. And I remember going around the ward comforting people who were weeping bitterly about what had happened to.
Well, are we talking about John F. Kennedy or Robert?
I'm so sorry, I meant John. I retract that. That was John
Yeah.
Kennedy.
Well, I mean, both tragedies, but easy to get confused.
Yeah, this was JFK. Yes, and that was kind of one of those moments that stays in your life, in your mind forever, about what that was like as a not just a national calamity for the United States, but the whole world felt the impact.
And so, how did that? So, what was going on in your life at that time?
Well, one of the things that was extremely impactful to me about patient care, and this has totally influenced my career, these were very formative years for me. I hadn't had a background where I'd been exposed to very much of life, apart from my family and the neighborhood.
I mean, you were only 22 when JFK was assassinated.
That's correct. And so the thing that impacted me most and very powerfully was that people were getting hurt in the healthcare system. And I can remember those patients absolutely vividly. One, for example, who was on some very powerful antibiotics too long and who died of a blood disease which was a complication from the antibiotics. There were some episodes in the operating room. I was in nursing school at the time the House of God was written, and medicine, not just in the Great Britain, but was very patriarchal and hierarchical. And the surgeons were, the top of the list, and they could get away with a lot. So it was quite a growing up experience to be involved in, I suppose, these dramas that were playing out and learn to understand how the world worked and how I wanted to fit into it or not. So those were very, very formative years for me, but in particular, my passion for working in an environment or being able to be effective in terms of patient care and patient safety, being an advocate for patients, was sort of cemented at that.
So just to understand that a little bit better. So when medical errors were occurring at that time, was it sloppiness or not attention to detail, and there wasn't any kind of review of when a clerical error took place?
I think it was a lot less formal. Clearly, in every profession, there are people who care deeply and different personalities. But I do think at the time, and it's been well described by others than me, that there was a sort of rather cavalier approach by the medical profession to patient care. And it's hard to describe, but there can be an arrogance in physicians then and even sometimes now, where it's less so now that I think about it, fortunately, where the patient doesn't get the best care. It's a complex construct, Bob, and it isn't all about bad doctors, as you know. It's about systems and cultures and.
So was there something in the system or the time that changed that for the better, or was it just a very gradual improvement process?
It's a very difficult question. I think it's been a very slow and very gradual improvement process. I still think we have a long way to go, both in England and in the United States, when it comes to the safety of patients as they traverse through the healthcare system. And I suppose one of my disappointments is that I haven't been able to make a bigger difference because we're still dealing at this day and age with far too many avoidable deaths due to medical error, not just in the United States, but in the UK and other civilized countries, as well as, countries who are less fortunate than us.
So how long did you stay at the London hospital?
I stayed at the London hospital. I'm not very good with dates and times because I'd been too busy living and looking at the next year rather than the past. But I was there a total of 5 years. And that was when I decided to get married, which was, a pretty standard thing that you did at that age in England at the time. And I went to live down on the south coast, but I continued working, and I
So
worked.
how did you meet this first gentleman?
Oh,
I mean, you gloss over that really quickly.
I met him. I was actually visit at one weekend when I was nursing. I was thinking I hadn't seen one of my favorite aunts for some time, and she lived a little up to the north of London. So I took the train up and met her. And then when I came to return, there was a snowstorm, and a really bad snowstorm, which was very unusual in England at the time. And the train was delayed, and so they were heating up. They had these braziers of coals where they were melting the ice on the tracks so that the trains could sort of move forward. And there were a cluster of us there waiting there for some time around this brazier, very, very cold at night. And I got to talking to this handsome man, and he became my husband. Ultimately.
Was this a long uh, matchmaking, or you got married the next day?
Oh, no, I think it was a couple of years before we got
Yeah, okay.
married. Yes.
Okay.
And we had two fine children, and we adopted a little girl, and we're all still very close.
So, and when did you make the transition to the U.S.?
I made the transition to the US in 1975, but it wasn't really an intended transition. My late husband, he's now my late husband, and I were very, very involved in Great Britain in the care of people who had psychosomatic illness. And it gets back to that mind-body split that I spoke about earlier, in that in England at that time, and I believe it was true in America too, there was far too much Librium and Valium being doled out when people were distressed or felt emotional, and a pill would solve it. And we didn't believe that. So we spent quite a lot of time actually going to classes. And when I started my interest in psychology, went to open universities were starting in Britain at the time. So while I was raising the children, I was also going to school. And I wanted to learn as much as I could about human behavior because I wanted to be able to make an impact on how people took care of themselves and how they were treated in the healthcare system, and also how we could better understand the mind-body connection. So it
Your
part.
husband also worked. Your first husband worked in healthcare as well.
Well, actually, without going into too much detail, my first marriage, by mutual agreement, didn't work out. We remained friends. He actually married my best friend, which was a good thing. And I was growing so fast and changing so much and wanting to explore the world. And we realized we had very different personalities. And later I fell madly in love with one of the loves of my life. I'm lucky enough to have had more than one. And he was a physician and had a deep interest we met through this mutual interest in the body-mind connection. And he was offered a position because we were both somewhat considered pioneers in England in this arena. And in the United States in 1975, the family practice programs were being legislated into universities. And so many of the universities were starting family practice residency training programs. And because we'd both been involved in training postgraduates in Great Britain at that time, we were asked to come over for a year to the University of North Carolina to help start this program. He was to be the director, and I worked with the medical school in the behavioral medicine arena because they were starting to introduce at that time human factors and topics like geriatrics that were being neglected, topics like human sexuality, nutrition into the curriculum. And there was the sort of movement to sort of bring back the general practitioner or the family doctor, as they became known, the family medicine. It was an extraordinary time to be in the United States. It was just post-Vietnam, tremendous amount of social reform occurring. We
What
absolutely
was this your first time to the U.S. or
no.
had you got?
I had been to I came to the United States. I think it was in 1971 because I was working part time with an American college in England and running their clinics and learning a lot about America and American students. And I came over to a student health conference, came to New Hampshire and Atlanta and was amazed by America at the time, but I never imagined in a month of Sundays that I would end up living here for the rest of my life.
So when you moved to North Carolina in '75,
Mm-hmm.
so you moved with your second husband and three
with,
children.
with my three children, and he was a single parent of two, so we actually had five.
Okay.
And Chapel Hill was a wonderful place to spend a year. At that time, we thought we were going back to England. And we were just, I think the word is entranced by America. We felt very comfortable here. We enjoyed the American culture, beauty of the country, and the energy of the country. There was a lot of energy at that time, and still is, to sort of move forward. And America, from the Brits' eyes, is a very innovative country, and we enjoyed and appreciated the innovation that was occurring and that we could be part of that. So it was a very, very good year. And then we were about to go back to Great Britain because he had a locum tenens running his practice. And they asked us if we would stay on another 4 to 5 years. That was a very difficult decision for a number of reasons, family and so on and so forth. But we decided we would and didn't regret it at all. And just as we were going to move back again, Ohio State University was looking for somebody to lead their family medicine program, or at least be groomed to be leader of that program. And we both ended up with jobs in Columbus, Ohio, in the same fields that we were both working in. I, by then, was deeply involved in what I call behavioral medicine, and the sort of softer aspects of medicine, such as communication skills and, how to break bad news to patients, how to comfort patients when they were, dying. And also, we were both extremely engaged and involved in the well-being of the people who were becoming healthcare professionals or who were already healthcare professionals, recognizing the stress and strain on that, on the people who provide the care. So Ohio State was very interested in not only my husband's skills, but fortunately mine as well. And we ended up moving, instead of moving back to England, we ended up moving in 1980 to Columbus, Ohio.
So just so Reagan had just become president, and
Yes.
so tell me about that transition in the '80s.
Well, the transition in the 80s was, initially a very exciting one because Ohio State was a very prestigious university. We'd also left a very good university. We loved North Carolina. Ohio, I think, reminded us a little bit more of the topography of England, so we probably felt a little more at home here. And we ended up buying a house just a little outside the city. It's not outside the city anymore. and we settled it. We were settling in, but something really tragic happened about a year. It was just over a year after we arrived in Columbus. My husband died very suddenly unexpectedly, he was a very healthy man, and he died very tragically, very suddenly. It wasn't self-inflicted; it was a virus that attacked his pancreas, and so all of a sudden,
I'm very sorry.
yeah, thank you. I was left in a sort of, you haven't experienced life, I don't think, until you've been widowed in a different country, in a strange city, um, and had to, with 5 children. It was growing up time, let's put it that way.
So can you recall the ages of your children at that time?
Oh, yes, they were 8, 10, 12, I think 14, 15. Those just going in, some just going into their teenage years.
So really really busy period. Young kids, in school.
It
Um,
was growing
well,
up time, as I said. It was survival time.
yeah, I can't imagine. Did you have much? Well, and then you had just moved to. You'd only been in Ohio for a year. So did you have much of a support system?
Um, we were beginning to develop a support system, but when my husband died, most of our family at the time was in England. Were in England, and all of them were actually, and except for my brother who was living in New York, and our friends were in North Carolina and England. So it was actually a very difficult time. And the other thing, of course, was financially, because English physicians do not earn the same capacity at the same rate as American physicians. So we'd come over on a year sabbatical, which was, not the highest pay. And we were just beginning to get our feet under us, both working with this large family when catastrophe hit. So,
Well, wait. So you had to. What? Why were you on sabbatical after moving from North Carolina to OSU?
no, we weren't on sabbatical then, Bob. We were on sabbatical that first year, but I'm saying the sabbatical pay is fairly low.
Right.
So we hadn't had much time to accumulate savings, or
Got it. Got it.
so we were. It was, I better hunker down here and work hard and
So how
keep.
did you manage? What? I mean, how did you manage? You were so you're working full time. I think
Mhm,
you had mentioned you were going back to school for your
correct.
master's or your PhD at the time,
Yes, correct. And well, it was my master's at the time, and
and taking care of 5 young kids.
yes, and also because of my late husband and my interest in the well-being of healthcare professionals, I brought in some extra money by doing counselling in the evenings in a little study that was at the side of our house. So it was, as I keep calling, I just call it growing up time. It's galvanizing, and you have to make a decision. People would say to me, I don't know how you do this. And I'm thinking, and the choice is? What's my choice
Well,
here?
what is your choice? I guess you just stop and hope the kids take care of themselves, or you kind of just have to do
I
the
think
best you can.
that, again, um, as long as there's love and routine, kids can be amazingly resilient. And obviously, at times like this, families can break apart or get closer. And we were fortunate enough to, become closer. Great set of kids.
That's great to hear. Um, so yeah, this all took place in your early 40s, 81, 82.
39.
Um,
My husband died.
I'm sorry,
I was 39.
you're 39.
Mm.
Um, well, what? So I guess well, you got through that decade somehow, and I guess the kids, went on to college or other careers, and what about yourself?
Well, um, I was just terribly fortunate to. I think what I want to express is what a kind nation America is, Americans are very self-critical, and but it's a very kind nation. People are people. The neighbors were supportive. People were absolutely wonderful. We were strangers to them, but they rallied around. I'll never forget, he died on March the 31st, and 1980, and it was just before Easter. And I woke up one morning and there were Easter baskets for all the children outside the back door. And those were acts of kindness that, were extraordinary. So when you go through difficult patches, it's amazing the goodness that you can experience in people to help you through. I think the interesting thing to me is you can't actually predict who they will be. If you had asked me before my husband died who would step forward, I might have had a guess, but it was unbelievably different to what I expected. So kind of in a good way. Mm-hmm.
And so I guess, well, then tell me kind of where your career went from. Maybe we can fast forward to say 1990. And did you marry again?
I did. I married a man with 2 children. So we bought this farm where I'm sitting now, and we raised 7.
7.
Yeah, I'm going to write a book. I've got lots of books I want to write one day, Bob. And of course, I'll never get to it. But one of them is called 3 Good Men.
I like the idea of that. That's that you shouldn't put that off.
No,
I think AI can help you write it.
The other one is Lessons from the Barn.
Listen, so do you mind? You want to share how you met your third husband?
Well, I was working in the healthcare field. I was working at Ohio State, and one of the doctors thought, when he was totally right, that my boys, 3 of the boys especially, needed male role models. And so he knew this man who was building and flying light, ultralight airplanes on a field of a farm not too far from where we live now. And that man happened to be Dave. I was not looking for a husband, believe me. I thought with all these children I was in for the long haul, the 5 of them. And but he, we met briefly, we talked, and I just noticed he had great blue eyes, and but I wasn't really sort of into men at that time. I was into hunkering down, raising the family, and my work was full time. Plus, I was in school. But he called me several months later to ask me how I was doing, and actually, I wasn't doing very well. I was in bed, sick, and I felt, gosh, nobody in the world cares how sick I am. The kids are in school. I'm pretty miserable. So I asked him when he called, well, do you want the social answer or do you want the truth? And he said, well, you better tell me the truth. So I told him the truth. And he said, sounds as if you would like dinner out one night when you're better. And I said, that might be nice. So that's how I met and married Dave.
And did you ever go up in the ultralight?
No, oh no, they're single. Now he's had a number of light aircraft. When we married, we wondered how we were going to put this already blended family together, and that's why
that's bigger than the Brady Bunch.
Yes, that's right. Sat down, and I'm sure I keep thinking people surely aren't interested in all this, but never mind. I need to focus on your questions. What happened was he's an airplane fanatic, so we bought the farm where my daughter and I could have, a horse each, and the kids would be kept busy on the farm. We could see where they were, and he involved the boys a lot in a lot of mechanical things to do with the farm and airplanes, which was wonderful. And I would go on occasional what I call save my marriage flights.
Save your marriage rights. So that was swallowing your fear of flying, or
right? You never fly with me. Okay. To me, I'm up in a plane going around in circles thinking, well, this is boring. I need to get back and get busy doing something. A terrible sickness, right?
Yeah. When I'm sorry to ask, is Dave still with you?
Oh, yes.
Okay.
Very long, very successful marriage, very mutually supportive. We both feel extraordinarily fortunate to have found one another. And without Dave, I wouldn't be able to do what I still do. He's knows who I am and is extremely supportive of my work. I'm very fortunate. He keeps the
So,
home burning.
when did Nebraska come into the picture?
Well, I think I've sort of got to retirement age about 3 times. And I was a chief academic officer at a healthcare, this large healthcare system in Columbus called Ohio Health. And I still had worked a lot with Ohio State. I had become assistant dean for medical students at Ohio State, and I really enjoyed and valued that job because of my interest in the well-being of healthcare professionals. But I got invited to Ohio Health to be, at that time, the director of medical education, meaning overseeing the medical students who rotated there, the residency programs, and continuing medical education. And I liked the concept of the broad spectrum from sort of beginning to end of medical education. And again, the opportunity to impact safety and quality of care through training. So that was what I did at Ohio Health. And we built one of the very first interprofessional simulation centers there, hospital-based, and got it up and running. And we were doing very similar work to the work that I'm doing in the University of Nebraska Medical Center right now. But it was unique at the time. And again, it was about using modeling and simulation to, like aviation and other, high risk industries, to address quality, safety, and cost. And Jeff Gold, who's now the president of the University of Nebraska Medical Center, who I believe you met, came down to visit us. He was at that time at the, I think he was provost at the University of Toledo Medical Center. And he came down to see what we were doing, and he decided that he would like to do something like that in Toledo. And I'd been at Ohio Health 17 years by then. And so I was sort of thinking, should I retire? It's about the fourth time I've retired or been on the brink of it. And I went up to Toledo to help him build a really large simulation center there, thinking it was the sort of the be all and end all of simulation centers. And I was there for 5 years maybe. And then Jeff left and went to the University of Nebraska Medical Center to be the chancellor there. And I went out to visit him, and he asked if I would consider, working with him to create an even bigger, even more comprehensive center there. And that was over 10 years ago now. And so I've been going back and forth to Omaha for the last 10 years to help create the center that you visited and where we,
So you've only been involved in Nebraska for 10 years, and before that, it was a combination of Columbus and Toledo.
Correct.
And I don't know how far Toledo is from Columbus. Is that did you relocate for that position, or you?
I had an apartment up there, and I went up on Mondays and came back on Fridays. And it was only 2.5 hours away, so that was nothing compared to the trip to Omaha.
And well, yeah. So how far is and you didn't fully relocate to Omaha? Is that correct?
I have an apartment there, which is lovely, overlooking the Missouri River, because I decided if I was going to, work this hard and not worry about whether to get hotel rooms every time I went out, that I would have an apartment there. And so I've been going back and forth for 10 years to Omaha. And the apartment also lets my family come and stay with me for weekends and grandchildren and things like that. So it shows them another part of the world.
So maybe as you look back a little bit, um, maybe over the last 20, 25 years, what what do you feel most proud about from a professional standpoint?
That's a very hard question because I'm mostly outward looking and not inward looking. Bob, I'm a strange person. I keep thinking, I, I think, I think if I've done anything, I've helped some people get through their medical careers. Everybody underestimates, or there's a general underestimation of what it's like to become a healthcare professional and what it's like to be a healthcare professional. And I'm deeply impacted by, how their well-being affects patient care outcomes. So I suppose if I'm proud of anything, it's having helped some people along the way. And I really mean that.
We have you think about it every day, that we have a really, really complicated healthcare system uh,
Mm-hmm.
in the United States, and you look at the UK, and it seems like NHS is barely staying together. Um, and there are no easy answers, of course, but if you pretend for a moment that you were in charge of it all, you maybe you were secretary.
Mm-hmm.
Um, what does have to change? What do we need to fix to make this a system that works? Because I do think there's so many paradoxes when you think about how do you make healthcare work from an economic standpoint and from a social standpoint. And I've kind of felt for a while about um, it almost feels like healthcare needs to be a fully nonprofit kind of system. But there is the argument to be made about well, how do you incentivize pharmaceutical companies to invest money and research if they can't recoup and innovate?
Yeah.
Um, and how do we retain workers, nurses, physicians? I don't know if it's a money issue or not, or if it's uh, you know, are they suffering burnout because they're so short staffed, and are they so short staffed because the pay is not good, or are different problems occurring that's putting, I mean, COVID aside, obviously, created a huge dent, and I think, caused a lot of burnout. But we're still dealing with it.
Yeah. Well, if you and I could solve that problem today, we'd probably get the Nobel Peace Prize. But it's so complex, such a complex system. And that's not just true in the United States. Even the national health system is extremely complex. I've just returned, for example, from the United Kingdom, and I had a friend there going through surgery. But he pays into the private system and gets his surgery privately because the waiting list is so long for things like a hip. Well, he's in his 80s and he didn't want to wait several years. So there's,
Several years.
yes, or potentially, yes, or at least a year. Even at, in your 80s, a year is a long time. And the truth of the matter is that I left feeling that England was actually a two-tiered system. There's the National Health Service, and then I actually visited the centres where he was getting care, and the waiting rooms were very full. So it's very complex. The single party system is burdened by many things. In terms of the trouble is healthcare keeps developing and getting more complex, and more technology can be applied to patients. And the tax, how much can you charge taxpayers to be able to afford that much care without rationing? You basically rationing isn't done purposefully, but it happens because priorities have to be decided, and that is a form of rationing, even if it's not called that. So I happen to believe if you look at all of the industries that have improved quality, safety, and cost, they have all used modeling and simulation, and more recently visualization, so that the people who do their jobs can practice in a safe place, become proficient, develop competencies, and not learn on the job as much as they used to be able to when life was simpler. And I really believe that the cost, if you think about patient safety, and if you just take unavoidable deaths due to medical error, it costs the United States over $1 trillion a year, and those are pre-COVID numbers. Imagine being able to save that much money and put it back into the system. So I think the problem isn't necessarily the infrastructure, although it has its problems, I understand. It's how do you provide safe, quality, efficient patient care? And I think healthcare professionals get under-supported, and by having centers such as the one in Toledo and in Ohio and in other places, you're seeing them evolve more now. Tampa and some of these mega simulation centers are involving having a safe place for healthcare professionals to practice. Isn't only good for patients, but it's good for the healthcare professionals, where they can prepare to do anything with anyone at any time. And so my concept would be to have large regional healthcare simulation centers that are connected to the rural communities, so that the rural communities aren't left out. And that's what we're
So,
working on in Nebraska right now, where we have this wonderful training center, and it's absolutely incredible thanks to the people of Omaha and Nebraska, and that it's in the city. And if what we're working on is this statewide network, so that rural practitioners at any level of training or learning new technology can connect to us to get the same level of support and care and practice that those who can reach the center on foot can. So I think a lot of it, and the military find the same, safety and outcomes and preparedness are at the core of everything, and in terms of outcomes. So,
well, let's delve just a little bit deeper into the medical areas. You mentioned, there are potential savings of $1 trillion, annually in the U.S. What is it that is it now? I don't know if addressing those areas are trivial issues, are process issues, are infrastructure issues, are training issues. But what is it that's keeping us from addressing and fixing those things in a meaningful manner? Is it will? Is it something else? Is it bureaucracy?
well, tradition has its place without doubt, and we should always respect tradition. But healthcare professions education is very traditional in its approach to how to teach people how to become doctors, nurses, and others. It is gradually changing, but probably not fast enough. Medicine and healthcare delivery is changing so rapidly. New technologies coming out all the time. And when you go into an intensive care unit, you can hardly see the patient. Imagine graduating from nursing school, being a medical student, and not understanding how all that works. You can't understand it all just by reading about it. So there has to be hands-on familiarity with equipment, and procedures are so complex now. The whole of medicine has changed. You don't have a patient asleep on the table very rarely, where you do a laparoscopy and you have the medical student or the trainee on one side and the experienced surgeon on the other who can guide their hands. It's done minimally invasively. So while healthcare has advanced tremendously, so has the technology and how you take care of patients or save patients' lives. And it seems inconceivable to me that we could still consider, training people on real patients.
Has the training not kept up with the advancements?
Well, I think we're talking about training everywhere, not education everywhere, aren't we? There's some schools are still very traditional where you learn knowledge and you take an exam and you pass the exam and you move on to the next level. And there's a gradual changing going on, but I'd like to see it happen faster in education and training in general, because the technology is there. We can create scenarios, we can put people under pressure, they can get familiar with equipment, they can develop proficiencies in safe settings and safe environments without the potential of harming a patient. And that includes communication and handoffs. And medical errors is a big topic, but you've got accurate diagnoses, delayed diagnoses. You've got the transition between healthcare teams, communication skills. It's not just about doing things to people. It's about helping people through the system. And that can all be practiced and perfected.
Is there something that's not being done well to address the shortage issue? Is it,
the shortage of
staff, of physicians, of nurses, of people going into into it as a career, or is that misunderstood? Is that not an issue?
Oh, I think it's a huge issue. And COVID was, obviously had an extraordinary impact on healthcare professionals. I get little notes sometimes from some of the people who were trainees when I was at Ohio State or in Toledo. And one of them was very heartfelt the other day. He just said he lost so many friends, patients during COVID that he absolutely burnt out, and he's now left medicine and he's become a writer. But the words he used was it took away his soul, which sounds very dramatic, but he's a very level-headed scientific man. And I believe that he's the sort of the tip of the iceberg, that what healthcare professionals went through during COVID, on top of an already challenging system, was devastating to the health professions. And then I do think that in turn has led to, understaffing and hospitals and financial situations and all of the things that come together to, create a situation of, health profession shortage or worse, even, as bad, low in morale.
Do you think, from a financial perspective, does healthcare need to be a fully nonprofit industry? Is the way it's being run? It doesn't seem like the way it's being run today is working, but I'm also not hearing or seeing any solutions coming forth. I'm just concerned about it breaking down at some point.
Yeah. Well, I don't want to sound too political, but it's going to sound political, but I don't know that government-run entities ever really work. So I think in healthcare, we need innovation, we need forward thinking, we need entrepreneurship, we need fresh blood, fresh life, not something that's too bureaucratic. You have to have guidelines and standards, obviously, but it would worry me to think of a single party payer, but that might be just because of my biases, because of having lived and worked in one.
But it seems though that the cost of health insurance continues to go up, and at this point, it feels like you have it for in case of a catastrophic situation. Um, but we're not able to keep it in check. I just don't know what model is going to work. Could a community based hospital healthcare system financially work if it was just based on the local population paying out of pocket or what have you?
Well, this has to be seen and discussed, I think, in the context of how healthcare is being delivered. From where me and my colleagues and I stand, we see the delivery of healthcare changing very, very rapidly. And while there will probably for a long, long time always be a need for intensive care in facilities like the university and other hospitals, an awful lot of healthcare now is being delivered remotely and in the home. So any decisions about how healthcare is going to be delivered in a cost-effective way where medical errors are at a minimum needs to be looked in the context of how rapidly healthcare is changing. I mean, and also in light of the rural-urban digital divide. So I don't have all the answers, but I do know that healthcare training has to be relevant for the times, and that technology is advancing dramatically in healthcare. I mean, we're seeing mini surgical robots, and we're seeing evidence that those can be, sent to a rural community and operated from a tertiary, a city hospital. We're still seeing so much change. We have to be very cautious and very careful. And my strong belief is that it's all in the training and constant upskilling wherever the healthcare is provided, which is why I'm so passionate about modeling, simulation, and visualization, to not only train, but also to, enhance patient care, the provision of patient care. The more we put in the hands of patients too, the better, really.
Yeah.
As long as they have good guidance and good counsel and competent people who take care of, do take care of them as needed. But competency is everything.
Well, Pam, Dr. Boyers, I don't think we're going to solve it today, unfortunately, but I want to thank you so much for your time and being, as open as you have been. It's you've had an extraordinary career. It's not over yet by any means. And but your insight and your opinion is highly appreciated and important.
Well, thank you. I just hope that if anybody listens, that they understand that, if you have a passion about something and you really care about what you do, it's amazing, how doors will open for you to, help you with other good people around you try to solve problems, societal problems.
Dr. Boris, thank you very much. And I look forward to seeing you next time. And enjoy the rest of the day.